so the next test we're going to do is the Clyger test. You're essentially going to have your hand on the lateral aspect of the knee, then have your other hand grasping the foot. So what you're going to do, you're going to essentially excessively evert the foot while pushing. Right like that. So the next test we're going to do is the compression test. It's very similar to the squeeze test of the leg, but this time we're doing it over the malleoli. You're going to take the heels of your hands, go down and essentially press them together. Maybe for any signs of fractures or anything like that. So the next test we're going to do is the distraction test. Essentially you're going to grab the distal ends of the phalanges and give them a little pull and a twist. So you're going to pull and a twist. You're essentially looking for pain as a positive sign. Then the next one is the compression of the forefoot. You're essentially like having your hands over the arches of the feet. Find that transverse arch area, stabilize it, and compress. So we're going to do compression at the base of the fifth metatarsal, which is essentially the same thing as the compression of the fourth foot, but it's the base of the fifth metatarsal. There we go. Find the base of the fifth here, and squeeze. All right, so next test we're going to do is a squeeze test of the leg. You're essentially squeezing the tib and the fib together. This is testing for, possible compartment syndrome. So you're going to go about midway up the leg and squeeze them together. You can feel them come together. Okay, so the next test we're going to do here is the tap test. This is to help identify fractures. You're going to take two of your fingers. You're going to find prominent bony structures in the feet. Tap them just like this. Now, if you're looking for an area that's particularly soft or covered by like a lot of skin, you want to create a base. And a positive sign for this is any pain or any like swelling. That'll usually be a telltale sign. All right, well, this next test is the Tinel sign. So you can tell your patient to chill out, relax. Then what you're essentially going to do is you're going to tap on their malleolus to try to get like the deep nerves. So you do this for both sides. Do like right anteriorly to the lateral, and then you want to do posterior to the medial. And this is just checking to see if there's if there's any tingling. That's a positive sign for some kind of nerve pathology. All right, so we're doing the Hava sign now. This is you want to test the tightness of the Achilles. So what you're gonna have your patient do is lie prone. You're gonna palpate the Achilles tendon with your thumbs. You're gonna have them plantar flex while you do it. You're gonna have them dorsiflex. You're looking for to see if one Achilles is more taut than the other. Do it on your other foot. You plantar flex now. And I forgot to mention before, you want to check every test bilaterally. All right, so this next test here is the Homan sign. This is to point out a deep vein thrombosis or a blood clot, and a positive sign is like intense pain in the muscle belly. So what you're going to do is passively push your patient's foot into dorsiflexion, and they should feel it right away, and it'll be a very intense, concentrated pain. So the first vascular test we're going to do here today is anterior drawer, and a positive talus side of this is anterior translation of the talus. You don't want that. So get your hand over here to stabilize. I'm going to push up on the calcaneus. And you should feel it slide, but not too much. This is from the neutral position. You can also do this in a prone position. Just the difference is you'd be stabilizing it, but pressing your body weight down more so than manually. And that's how you do the anterior drawer test. Yeah, the next test we're going to do here is the Taylor tilt. You're going to test this for inversion and eversion, and you're going to have the patient lay on the side, but firmly grasp here. You're going to push down and put them in the inversion, and likewise the other side. This will be eversion, pushing the foot down. Voila. The next test we're going to do is the Duchenne's test, and you come over your patient. They're going to usually lie prone. And take your thumb, you're going to press it into their first. You're going to push them into dorsiflexion and tell them to plantar flex. So push your foot down. Push your foot down to the floor through resistance. And a positive sign of this if the ankle rolls or it supinates.